Hello, welcome to Smile with Pediatrics. Today's topic is the easy algorithm. The easy algorithm is predicated upon the fundamental principle of medical ethics, primum non nocere, which means first, do no harm, such that the delicate balance between therapeutic risks and benefits is decisively tilted in favor of the benefits for each individual patient. To achieve this, patients are triaged into two groups right at the time of first examination, depending exclusively on the clinical signs by using a unique tool. And in each group, further differentiation of treatment is done to accommodate various patterns of presentation in children with sepsis. The tool for the triage are the Be Careful signs or B signs, which are severe respiratory distress, grunting, distended neck veins and hepatojugular reflux, tender hepatomegaly, cardiomegaly, edema and S3 gallop breathing. Patients that have no B signs get regimen 1, where they receive a crystallite bolus of 20 ml per kilogram. The presence and severity of crepitations or crackles on auscultation determines whether the patient gets the fluid bolus immediately or only after receiving respiratory support. Note that the fluid bolus is given because of lactic acidosis, which is almost always present in sepsis or infections, and not necessarily for small volume pulses or absent pulses or hypotension. Thus, it is not meant only for patients in shock. Monitoring of the patient after the fluid bolus, as well as the decision to administer further boluses or perhaps to switch to regimen 2, are guided by the monitoring flow chart. Regimen 2 is for patients who present with any of the B signs or any other reason why aggressive fluid resuscitation is not recommended. It can be observed that the B signs are clinical features of circulatory and pulmonary congestion, heart failure, and cardiogenic shock, and they indicate the need to be cautious with fluids. The presence and severity of crackles further triages regimen 2 patients to receive different therapeutic choices. Furthermore, no fluid bolus is given to patients with any of the 3 critical signs of this regimen, which are S3 gallop breathing, grunting, and severe respiratory distress. Rather, patients with any of these critical signs immediately get respiratory support and often require early administration of vasopressors, inotropes, or diuretics, either singly or in combination. Whether or not inotropes and vasopressors are administered depends on the index patient's clinical state, bearing in mind that patients with sepsis-induced myocardial dysfunction, cardiogenic shock, or cardiac failure would often require one or more of these cardiovascular agents, and early commencement is often very crucial to prevent deterioration and death. Similarly, the use of intravenous furosemide is based on the patient's clinical state, bearing in mind again the delicate balance between circulatory congestion and shock in these severely ill patients. Hence, caution and close monitoring are recommended with the use of diuretics. Monitoring of the patients that get regimen 2 is also guided by the monitoring flow chart. So the two regimens 1 and 2, and the monitoring flowchart make up the easy algorithm. Functioning side by side, each component element of these regimens resemble the parallel rays of the sun that blend and work together side by side to achieve the ultimate goal. A unique quality of the easy algorithm is that it relies exclusively on clinical signs, and this makes it ubiquitous. However, where relevant medical equipment are available, they may be incorporated into regimen 2, but remember that the simpler, the better. The preference of one inotrope or vasopressor over another is guided by the hospital's existing guidelines and the physician's experience. The easy algorithm is uniquely designed to be comprehensive, but like everything in medicine, there may still be a few intricate presentations of sepsis that require more delicate consideration. This brings to light the role and importance of the clinical prowess and judgment of the managing physician. Sometimes, indeed, a multidisciplinary approach may be needed. Despite these nuances, the easy algorithm still provides a useful template even for such complex cases. In summary, the easy protocol does not negotiate with sepsis. Our next video will feature a few practical examples. Thank you for joining us on Smile with Pediatrics. Please remember to like and subscribe to our channel.